Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're talking about whenever you have like an expansion case, be it a Schwartz or a RPE and RME, you're doing palatal expansion on a growing child or a teenager to try to develop the arches before you moved on to this second part. Let's say you're doing this all in phase 2, or even if you're doing it all in phase 1, you're doing it all in comprehensive, doesn't matter. A lot of times, your first step is going to be fixing the bite and developing the arches with some type of appliance. It could even be a twin block, anything like that. So not just expansion, an appliance, let's put it that way, fixed or removable. It's pretty normal to do, before you move on to either your braces or your clear aligners, your Invisalign. So one thing that I see that goes wrong a lot in these cases, and I see these cases every day for the last 20 years, is that a lot of doctors rush to finish the appliance therapy and move on to the alignment stage without realizing that not only should there be a retention phase in between where you stabilize, hold the segments so that the bone can fill in, the teeth can solidify in the bone, but there also sometimes needs to be a settling phase. And let's talk about that. So I've definitely talked about the retention phase before. If you want to watch that video on how long, when, how do you know, you should go to my phase 1 playlist, which is still available at the moment for free in my YouTube channel. Subject to change, as we have just launched a phase 1 interceptive course as of this week. There is a course, it's available on my website without CE, but with help on 2 cases. And there's a course going to be available and sponsored by CE Zoom, which is a separate company. They're going to be offering 13 CE units and a 65 question quiz. Yes, I had to write it so that you guys can get CE, 13 units of on-demand CE. So anyways, if you want to access that free information at the moment, you can find the free information at my YouTube channel, which is Straightsmile Solutions. Go there, scroll down on the playlist. It's also available on my website. You can find it under education. I think it's the first or the second tab. I think it's the first. It says like educational materials or something like that. Anyways, so watch those videos first. Matter of fact, you should watch the entire phase 1 playlist or take my phase 1 course. It's pretty much the same thing. It's just the course is extremely organized and has chapters and goes in a particular order. If you just go to YouTube, it's going to be random and then it's going to be hard to know where you should go next. So, but hey, that's what happens when you want free. So the question was, how do we need to take a pause or a break to let the bite settle? Well, how do you know? Well, a lot of that really just depends. It's really easy. It's a very easy question. All you need to do is use articulating paper. Articulating paper, it doesn't even have to be that. If you have a scanner, you can scan. I mean, articulating paper is the OG scanning to see bite marks, right? Tap, tap, grind, grind, bite around, see where the marks are. I want to see pretty solid bilateral contacts on most, if not all, the posterior teeth. Premolars, molars, whatever's erupted. If you only see like 1 or 2 points of contact, no, bite's not settled. If you only see contact on one side of the mouth, no, bite's not settled, okay? Settled bite. So sometimes, you can get interferences, cuspal interferences, or if you're doing like an anterior bite plate or a fixed bite plate on your appliances, yeah, I mean, that's normal to not have the bite settled. After the retention period, everything's stable. Let's give it some time for the bite to settle. Otherwise, if you don't, first of all, sometimes you can have weird shifts that you're kind of unaware of, and I'm pretty good at noticing shifts. But trying to build that shift into an Invisalign Clincheck is, that's not possible. You're probably going to get it articulated wrong. If you get it articulated wrong, you're going to have a weird canty outcome that's going to probably take you an extra year to fix. And this is the biggest problem. And Invisalign is not going to tell you that this is happening. First of all, I don't think they even know. Second of all, they don't care. Second of all, third of all, it's your problem. You're the dentist, okay? And this is probably, I would say, top 3 reasons I see Invisalign cases fail is something like this. It was not articulated properly to begin with. And that is something that they never teach in any of these engine courses, Gallagher courses, Moelis courses, fundamentals, Invisalign. Nope, they never mention that. It's such an easy fix. Just do it. It takes 1 second. Your assistant can do it. They can even do it from home. You can mail them a piece of articulating paper and use a HIPAA compliant program like there's HIPAA compliant Zoom. There's all kind of HIPAA compliant apps. You can use In-Hand Dental, which is one of my favorites. You can use Invisalign Virtual. I don't really care. Check it from home. They don't even have to come in. Just make sure you can scan them. All scans usually show you the articulation marks. Make sure that you got nice, solid bilateral occlusion before you start your Invisalign case. If you don't yet, take the appliances away, assuming they've done their normal retention period of 3 to 6 months with their appliances, depending on what appliance you had and where they started and how compliant they were. Take them away. I actually really want you to take them away and let them settle for a few weeks. Try again. Not settled, a few more weeks. Try again. So there's a really important loop there where you need to be keeping an eye on your patient, and you have to know when the right time to start is. And it's hard because I know a lot of times patients are really in a hurry to get that Invisalign started, really hurry to get rolling on their case. Now, this is much more of a problem with clear aligners because we do have to set the articulation, and much less of a problem with braces. I don't think I ever wait for bites to settle with braces because I really don't care. It's gonna settle in braces. I'm not worried about that. It's not like we're predicting the future and we have to get the bite perfect now so that we can set it to the end, you know? Braces, it doesn't matter. Bite's gonna settle. I can just give some box elastics. So not a big deal. So I'm more talking about Invisalign. All right, hopefully that was helpful. This is like literally probably, like I said, top 3 issues that I see in cases every week. All right, thanks.